Hello, my name is Logan Weisberg, and this is my skill assessment. So let's get started. So the first skill is control moderate and severe bleeding using universal precautions. So what you want to do here is you want to wear gloves to protect yourself from exposure to blood and body fluids if they're available. Also, mask, goggles, and a gown is good. Carefully remove or cut away clothing to expose the wound and be gentle to avoid further injury. Next, I'll show you how to control the bleeding. You want to have direct pressure, apply firm, steady pressure directly to the wound using a sterile dressing, clean cloth, or any available material if nothing else is at hand. If blood soaks through, do not remove the original dressing, but add more on top and continue to apply pressure. So here's my limb. This is our test dummy. If he's bleeding, apply pressure, wrap the wound, and then if the blood soaks through the wound, you don't take off the wound. You add another layer to this. Add another layer and apply pressure. Elevation. If the injury on the limb and there is no suspicion of fracture, elevate the limb above the level of the heart and reduce blood flow to the area. So here we go. Elevate it like about there. Pressure points. Directly apply direct pressure and elevation are not controlling the bleeding. Apply pressure to the artery supply for the area. For example, use the brachial artery for arm injuries and femoral artery for leg injuries. All right. So next skill is splints. Splint a suspended forearm fracture. So first you want to check for any open wounds or deformities. Then you want to evaluate circulation, sensation, movement, CSM, the affected limb. Check pulse. If the patient can't feel, if they can feel touch, and check for any numbness, tingling. So numbness, tingling, pulse. Big part. Position of comfort. Ask the patient to keep their arms in the most comfortable position, and usually this is with the elbow bent at a 90-degree angle and the forearm supported. So bent at a 90-degree angle. Place padding around the injured site, prevention, pressure sores, and increase comfort. Ensure there is an adequate padding area in the padding areas and where the splint will make contact with the skin. Placement. You want to place the splint underneath the forearm. Ensure it extends beyond the joints and elbow below the wrist to the injury to fully immobilize the area. You want to secure the splint using bandages or strips of cloth to secure the splint. Start by tying above and below the injury site, then add additional ties as needed. Do not tie directly over the fractured site. That's really important. Check tightness. Ensure the splint is snug but not too tight. Recheck the circulation, sensation, movement, CSM, securing the splints. The patient should still have a pulse and still be able to touch their fingers. So yeah, they should be able to touch their fingers. They should have a pulse. I mean, obviously they still need to be alive, so they need to have a pulse, even though that sounds kind of cynical. But it's true. And I'm just going to make sure I'm still recording. I am. Okay, cool. And then, yeah, let's get on to our next skill. So demonstrate how to transport an injured athlete with at least 2 carry techniques. So I have 2 carry techniques for you here. A 2-person carry seat. So the 2-person carry seat is useful when an injured person can sit up and needs to support to move but cannot walk. This is a method that provides a stable seat for the injured person. Position the helpers. Helpers must stand on each side of the injured person. Each person wraps one arm around the injured person's back and underneath their armpit. The other arm is placed underneath the injured person's thigh. You want to create a seat. The helpers interlock their wrists or clasp clasp hands underneath the injured person's thighs, forming a seat. Lifting the injured person. Now the helpers can count to 3, lift the injured person simultaneously. The injured person should be sitting securely on the seat formed by the helper's arms. And then finally, transportation. Walk carefully in unison, maintain balance, avoid the jolting, and communicate with injured person to each other to ensure stability in the movement. Okay, my second one is called the four-handed seat carry. Four-handed seat carry. And the four-handed seat carry is another effective method for transporting an injured person who can sit up but cannot walk. It provides a broader base of support and is useful for moving injured persons over a short distance. The steps for this include position the helpers, two helpers facing each other. They create a seat. Each helper extends an arm forward and one arm backward. The helpers then grasp each other's forearms from a square seat with 4 hands. They assist the injured person. The injured person is helped to sit on the seat formed by the helper's arms. The injured person can place their arms around helpers' shoulders. The injured person should place the injured person can place their arms around the helper's shoulders for added stability. Very important. I had to reiterate that. Lifting and transporting on a coordinated count of 3, like 1, 2, 3. The helpers lift the injured person and walk carefully, communicate to ensure the injured person is comfortable and stable. Okay, so the last skill in this assessment is apply compression wraps for swelling on an injured ankle. This is important. Materials needed: elastic bandages, ACE bandages. Now I have some bandages right here. This is an example of what you don't want to use because these are band-aids. This is for like a paper cut, but when you're dealing with an injured athlete, you're going to want to use ACE bandages. Tape, and then also in addition to the ACE bandages, you want to use tape or clips to secure the bandage. So let's go over the steps. First, you got to position the ankle. Have the person sit down or lie down with their leg elevated, elevating the ankle, reducing swelling. So elevating the ankle, reducing swelling. Start to wrap. Begin wrapping above the toes, leaving the toes exposed. This allows you to monitor circulation. And then you want to wrap around the foot. Wrap the bandage around the foot, moving from the base of the toe toward the heel. Make sure each layer overlaps the previous one by about half the width of the bandage. Figure 8 technique is when you, after wrapping the foot, you continue with a figure 8 pattern around the bandage diagonally across the top of the foot, then wrap it around the ankle, and then continue this pattern crossing the foot, wrapping around the ankle, ensuring that the bandage covers the entire area, but it's not too tight. You don't want the bandage to be too tight, but you don't want to be too loose. So you have to see what's comfortable. And you want to cover the ankle, continue wrapping up the ankle, moving toward the calf. Make sure the wrap is snug but not too tight, like I just said. You should be able to slide your fingers underneath the bandage. And then you want to secure the bandage. Once you reach the top of the ankle, secure the end of the bandage with tape or clips with the bandage. Ensure it's secure but not restricting blood flow. Check circulation. Check the toes for signals of good circulation. They should remain pink, warm, and the person should be able to wiggle their toes. If their toes become cold, pale, or numb, the bandage is too tight and should be loosened. Loosen the bandage. And then lastly, you just want to monitor the injury. I mean, keep the ankle elevated as much as possible. Reapply the wrap if it becomes loose or uncomfortable. Ensure the wrap is not causing any pain. So that is my skill assessment. Thank you for tuning in. See you next time.